All right, so we'll go ahead and get started here. My name is Todd Tupis. I'm an orthopedic surgeon at OrthoSC. I practice primarily in the Conway location. I am fellowship trained in sports medicine. I do primarily shoulder and knee surgery and have been sort of involved with regenerative medicine throughout my training and currently use some of it here in practice. And so today's talk is going to focus on sort of what regenerative medicine is, what options are currently available in 2020, and kind of how it works and why it works and what I think is available and what is actually a good option here in 2020. So let's go ahead and get started here. So the objectives, we're going to talk about what is regenerative medicine as it relates mostly to the musculoskeletal system, what is currently being used in 2020. So we're going to discuss PRP, amnion, some other birth products, and then VMAC and adipose tissue. And I'll go through each one of these and discuss what they are. We're going to discuss a little bit about the regulatory processes that are upon us, and then discuss why biologics and regenerative medicine might be able to help you and your current situation. So the first thing first, what is regenerative medicine? Simple definition is it is the process of replacing, engineering, or regenerating human or animal tissues to restore normal function. This is a field that probably in the last 10 years has really started to rapidly expand and currently is exploding in the last couple of years. I'm sure most of you have been probably bombarded on social media with some type of advertisement for stem cell, regenerative medicine and all these other things. So this field is rapidly expanding, and just like anything that expands quite rapidly, unfortunately, there is a lot of misinformation that is out there, and there's currently very little to no oversight and regulation in this field. And so a lot of people who may not have the most strongest ethics certainly are there to take advantage of the current status of regenerative medicine. So what is all the hype about? Well, certainly when people hear regenerative medicine, I think most people certainly start to think about stem cells. If you look even in this area and across the country, there are hundreds to thousands of stem cell clinics that are open and operating. Unfortunately, most of these are run by non-physicians, and most of them are run by chiropractors or naturopathic physicians. There are some that are being run by actual physicians, like some pain management physicians. However, I would say the majority, including in this area, are being run by chiropractors. And most people don't realize they are actually unlicensed to give injections. And so what they do is they hire nurse practitioners to do them for them. This field and this whole stem cell clinic idea has gotten so out of hand that Google has actually stopped all stem cell and regenerative medicine advertisements on its website. And so if that doesn't tell you that there's a problem, Google being the largest search engine in the world, it just goes to show you that there's certainly some unregulation of what these clinics are and how they're operating. And so who is regulating them? Unfortunately, really not anybody, because the FDA and has basically stated that all of these so-called regenerative medicine options and all of the ones that I'm going to discuss today that are available, none of them are FDA approved or regulated for any type of treatments. And so the FDA states that you cannot take a tissue out of the body and alter it from its original form to be used as any type of therapy for treatment on any particular body part. So that means I can't take your blood or your stem cells or your fat tissue and take it out of you and then manipulate it really in any way and then give it back to you. And so unfortunately, many of these quote unquote stem cell clinics are operating outside of the FDA regulations. And so I've seen and heard of reports in other states where the Department of Justice has actually cracked down on some of these stem cell clinics that are basically operating under false advertisement, and we'll discuss why that is. So the simplest way of putting it is, unfortunately, these are not being regulated by the FDA, and so therefore a lot of people and non-physicians and even physicians are taking advantage of that. And so what has that led to? That has led to, in the last year, the formation in the orthopedic world of what we call the Biologic Association. And so these are some of the leading orthopedic societies and leading orthopedists. A lot of them are sports medicine specialists across the country and world that have come together to form this Biologic Association so that we can study and provide regulation of the use of biologics in musculoskeletal medicine. It's not that we don't want them to be used, we just want them to be used safely and for ethical reasons and for reasons that actually have data and evidence to support their use. So what are we talking about here as far as regenerative medicine? At a sort of cellular level, we're talking about cellular therapy, and that's actually probably a better way to put it as opposed to stem cell therapy, because most cellular therapy, or most people who quote unquote say they're using stem cells, are actually not using stem cells. Unless you are involved in a FDA regulated level 1 trial, most likely at a large academic research institution, you are not getting stem cells, period. Most of the cells that are being used, if someone is actually giving cells, are what we call progenitor cells. And there's a fancy diagram over here. The bottom line is the difference between a true stem cell and these further cells down the lineage is that a stem cell can become any other type of cell, and it has the capability to reproduce itself with no end in sight. Progenitor cells are a little bit further down the lineage here, and that's mostly what when we discuss stem cells, unfortunately, the nomenclature becomes confusing even amongst physicians and researchers. And so progenitor cells can only become bone, fat, cartilage, or muscle. So they're not true stem cells. And when somebody gets a bone marrow aspirate and they say they're getting stem cells, they're actually getting progenitor cells, not true stem cells. So that's not to say that progenitor cells cannot be useful. So progenitor cells certainly are useful. They relieve pain by activation of mu opioid receptors. And so they have a really strong anti-inflammatory effect. And you're going to hear me talk about that over and over when we get into the specific details about why these things work. They really work through decreasing inflammation, just like anti-inflammatories like ibuprofen do, and just like steroids like cortisone injections. They all are strongly anti-inflammatory. And the bottom line is, can they rebuild tissue? Can they rebuild cartilage? And the answer right now is we don't know. And there's no evidence that any of the current available cellular therapies can regenerate tissue and in specific cartilage. And we'll discuss why that is. So the first thing, and probably the most common thing that, at least that I use in my office and on a day-to-day basis, and has the most actual literature to support its usage because it's been around for probably 20 to 30 years, is what we call PRP. PRP stands for platelet-rich plasma. Plasma is the liquid portion of our blood, which is composed of water and proteins, and the platelets are tiny cells that help form clots when you cut yourself and you bleed. The platelets are produced inside our bone marrow, and they circulate every 8 to 10 days. So what are platelets? They arrive at the side of a cut, and then they form a clot through a process called adhesion, and then they actively signal more platelets to come. Platelet aggregation occurs through the clotting cascade, and this is activated through something called growth factors. And so growth factors are really the driving force behind why most of these cellular therapies work. So what is PRP then? So what it is we draw your own blood. So it's using your own tissue. And in my office, you come in, we do a regular draw blood, a regular blood draw. And it's just like, you know, donating blood, except it's a much lower volume of blood that you give. And so we take that blood and we concentrate it. And so PRP is using your own blood to concentrate the platelets to 5 or 6 times the normal blood levels. In that process, we centrifuge them, spin them rapidly in a centrifuge. It separates out the red blood cells. And then there are varying degrees of white blood cells. And really what it does is it concentrates those growth factors. And I have that in all capitals for a reason, because most of these things work through a number of growth factors. And I don't want to get into too much detail in this particular talk, but it really is why platelets and bone marrow aspirate and even some of the other things work, is because they work through the growth factors that are inside of these cells. And so there are 7 fundamental proteins which are considered growth factors, and I'm not going to go through each one of these, but bottom line is they sort of do a bunch of different things, but strongly anti-inflammatory, and they also can induce growth of new blood vessels and other things inside the body. And so another busy slide, and again, this is probably a little bit beyond this talk, but they can induce different types of growth. They can induce bone regeneration and remodeling, cell growth, new blood vessel cell growth, and again, they're very, very strongly anti-inflammatory. And so for muscle injuries, PRP has been shown to expedite healing through cellular proliferation and differentiation, which leads to muscle regeneration. And that's just for muscle injuries. PRP has probably, like I said, the most evidence for different musculoskeletal problems. And so I'm going to go through a little bit of each one of the problems that I currently use it for. Just sort of quickly, there are different concentrations of white blood cells inside of PRP, and so not every PRP is created equal. And so that is one of the reasons why there's a lot of differing information out there about what works and what doesn't work. And so mostly when it comes to treatment of arthritis, which is kind of what I'm going to focus on in this talk, you want very, very little white blood cells inside your PRP formulation. And so there's another busy slide which kind of goes through all of that, but if you're going to get PRP, you know, you need to sort of discuss that with your physician about which type of PRP he or she is using. And so what everyone really wants to know is, does it work? The short answer is yes, and there are some things that it doesn't work for. I'm going to mainly focus on what it does work for. You know, again, there's different variables to look at when you look at the literature. There's different formulations. No one really knows the optimal timing, the optimal dosage, the optimal frequency of these types of injections, and differing types and locations of injuries is variable. Current uses for PRP, I use it in my office for osteoarthritis, for shoulders and knees primarily, but you certainly could use it for any joint that you have arthritis in. You can use it on acute and chronic tendon injuries, for muscle injuries, and potentially as a surgical augmentation. So lateral epicondylitis, just quickly, this is in lay terms, this is tennis elbow. There are a number of studies on this. Overall, most studies do show improvement versus placebo or steroid injections. And so in my practice, I will offer this as a sort of last option before surgery, after people have failed conservative measures. And it does hurt quite a bit, but it has been shown to be quite helpful. How about rotator cuff tears? There's no studies that show any benefit for non-operative treatment of tears. So to say that again, if you have a rotator cuff tear and you're considering getting PRP as a treatment as opposed to surgery, there is no studies to suggest that it works. There are some studies that show if you add PRP into the surgical repair site that it does improve the healing rate some. But is it worth it? No one really knows. I currently do not use it in surgery unless somebody actually requested it, but I would not recommend it as a non-surgical treatment for rotator cuff tear. How about osteoarthritis? And there are, numerous studies out there, and this is just one that that I pulled. And so this is a study where they compared PRP to what is called hyaluronic acid. I'm sure many of you that are listening to the talk today have heard of what we call either gel injection. Some people call it the chicken injection, but what that is a hyaluronic acid injection that you inject into the knee for osteoarthritis. That is, fortunately, it is FDA approved for treatment of knee arthritis, and so Medicare and most commercial insurance companies will pay for it. However, PRP, as I said before, is not. And so PRP is not covered by any insurance companies. This is a head-to-head study comparing PRP to those gel injections, and they did 99 patients. They each got 3 weekly injections of either PRP or hyaluronic acid, and they showed there was a clinically significant improvement in pain scores at both 6 months and 1 year for the PRP group. So, the bottom line is PRP is helpful. It does improve pain scores in arthritis, and it does make your joint feel better and function better. Therefore, if you do not have pain, but there is no evidence that if you have bone-on-bone arthritis, that all of a sudden it's going to grow new cartilage inside your knee. The reason it works, going back to it, like I said before, is because the growth factors inside the PRP formulation are strongly anti-inflammatory, and so they decrease pain through stopping inflammation, but they will not grow new cartilage in your knee. So for somebody that asks me, am I a candidate for our PRP? I look at their x-rays, I discuss with them based on age, activity level, and almost everyone is a candidate, but I would sort of counsel somebody if their knee is bone on bone and they've failed pretty much everything else, then it's likely that PRP is not going to give them significant relief. But if you have more of a mild to moderate arthritis, then PRP seems to work better for those patients as opposed to the sort of end stage arthritis. My current protocol for treatment of arthritis is to recommend either a series of 1 up to 3 injections performed over 3 to 4 weeks. And I use a PRP formulation that has no white blood cells or very little white blood cells in it. And recently there is some who have advocated actually injecting that gel along with PRP at the same time, and they've been found to have some synergistic effect where they will actually work better and longer together. And so that is an option to do both of those at the same time. So the next thing that I'm going to move on to after PRP, and I'm not going to go into as much detail as these other ones because they all sort of have sort of the same basis to them. So BMAC stands for bone marrow aspirate concentrate. And you can see right here, this is a patient that would be lying on their stomach. And typically this is done by harvesting the bone marrow from the back part of the pelvis. And typically you would use your own tissue. So this is invasive. Most of the time it can be done under just local. Sometimes it may require sedation, and it's very similar to PRP. Essentially what you're doing is you're drawing blood and bone marrow products out of the inside of the bone, and then you're putting it into a test tube, you're spinning it in a centrifuge, and you're concentrating platelets, you're concentrating growth factors. And the inside of our bone marrow, there are some of those progenitor, quote unquote, stem cells like I had talked about. However, most studies show that those cells are only 1 in about 100,000 cells. And so you may be getting some stem cell or progenitor cells inside that bone marrow aspirate concentrate, but it's very, very few. And so currently what we're doing at a orthopedic and research level is trying to figure out ways where we can try to increase that number of progenitor cells. And so the bottom line is, can it be helpful? This is a little bit difficult to assess because there aren't a lot of studies out there right now on bone marrow aspirate. There are different formulations of it, just like with the PRP. And again, it's invasive. It's a much more invasive harvest compared to PRP. And really, it's working through mostly growth factors. And so typically, I recommend to people that, you know, if you're considering doing a regenerative option and you're thinking about PRP versus BMAC, well, PRP is a lot less invasive. It's just a blood draw compared to aspirating bone marrow. And in most cases, it's a lot cheaper to do PRP than it would be to do bone marrow. And there's no evidence that the bone marrow works any better than PRP. So typically, I recommend just doing PRP. I don't think there are many clinicians in this area currently doing bone marrow. I do have a partner or two, and I would myself do it, but I just haven't had many patients that were willing to go through with that procedure. Again, so there's numerous studies that do suggest improvement in pain scores with osteoarthritis, but once again, there's no evidence that it can regenerate cartilage or regenerate any tissue inside of our bodies. So what else is available? The next sort of category is what we consider birth products. And this, I would tell you, the majority of the clinics in the Myrtle Beach and Grand Strand area, when they advertise stem cells, they are truly not giving you stem cells. And what they most of the time are giving you is this first thing, which is amniotic fluid. And so I think if you have been to one of these, you know, I think since COVID has happened, they've sort of stopped a lot of these talks, but they've been pretty aggressive. The chiropractors have on, you know, well, inviting you to dinner, come hear about these stem cell injections. Well, like I had said at the beginning of the talk, that really is a misnomer. They're really not giving you stem cells. And I would, you know, challenge anyone who told me that they were, that it really is not. And so most of the time what they're giving you is amniotic fluid. There also are chorion, Wharton's jelly, and placental fluid injections. And so, you know, if you look at amniotic fluid, it is a great source of true stem cells. And unfortunately, there is a huge difference in the number of cells that are harvested directly at the time that, you know, a woman gives birth. If you, you know, have, you know, anybody that you know that's given birth, they ask you if you want to keep the cord cells to, you know, freeze them for potential use down the road for stem cell usage. Well, that's because there's a very concentrated number of stem cells there. Unfortunately, if you look at the pre-processing and sterilization versus post processing and sterilization, there is a huge difference in what is actually in these products. And so again, there's a large number of products. This is right now like a $40 billion a year you know, field, just these birth products, and it's being pushed heavily, particularly again to the non-physicians. And so it's very easy for them to say, oh yeah, I'll take this product and I'll inject it. The problem is most patients, they hear stem cell, or what they really market it as is stem cell therapy, and they throw that word therapy on there so that if a patient did challenge them on that, when they say, well, it's not stem cells, it's stem cell therapy. And the reason they say that is because there's actually not true stem cells. And so if you look at, there have been several studies in the orthopedic literature. This is one that I pulled out of the American Journal of Sports Medicine. And this was a study where the title of the study, Are Amniotic Fluid Products Stem Cell Therapies? ? This was a study of amniotic fluid preparations for mesenchymal stem cells with bone marrow. And so what they did was they took 7 commercially available amniotic fluid products and analyzed them compared to bone marrow. And essentially they found that all 7 of these amniotic fluid injections had no living cells in them. So if there are no living cells, that means there are no stem cells either. Now, there are growth factors in these products, and so that is why they can be useful. And I'm not here to just say that they aren't useful, but I think they're being marketed in the wrong way. So again, most of these amniotic fluid injections have been found to have no living cells, and so therefore no stem cells, but they can be effective. So do they work? Again, the answer is yes and no. Most studies suggest that they do have a strongly anti-inflammatory effect. And again, going back to these growth factors, just like with PRP and just like with bone marrow aspirate, amniotic fluid, placental fluid, they have numerous growth factors in there, and so they're working because they have a strong anti-inflammatory effect, and so they can and have shown good improvement in pain scores in patients with osteoarthritis. However, there's no evidence for cartilage regeneration, and I can tell you just through patients of mine that have come to me after they've been to some of these quote unquote stem cell clinics, they're very, very expensive. I've heard anywhere between $4,000 up to $10,000, if not more. And you know, I've seen the ad even in this month's Grand Strand magazine of a, you know, bone on bone arthritic knee, and it's one X-ray next to another, and the post injection X-ray shows an improvement in the cartilage. You know, and unfortunately, that's a complete false advertisement, because there's zero evidence that it can regrow or restore your cartilage inside your arthritic joint. And so, yes, they can be helpful, but unfortunately they're not going to prevent your knee from, you know, deteriorating or ultimately possibly requiring a joint replacement. Lastly, I'm going to cover adipose. And so adipose is basically fat tissue. And so there was two teams of researchers, one at University of Pittsburgh, one out at UCLA, probably 10 years ago, that found that fat or adipose tissue has a very high concentration of mesenchymal stem cells. And they found that these cells sort of hang out around the blood vessels inside of our fat. And so they've used this to take advantage of this, and they've harvested basically using liposuction from the abdomen and thigh. There, you can also, they've come up with ways to, if I was doing a knee arthroscopy, where we can use the shaver to shave out the little fat pad that sits behind our kneecap, and you can harvest stem cells from that. And unfortunately, there are many different processing techniques, and it goes back to the whole FDA thing about not manipulating the tissue, and some have called into question whether, you know, we're manipulating the tissue. In Europe, they can actually take the adipose out and then treat it with enzymes to sort of activate these stem cells and then put it back in our bodies. Unfortunately, in the US, we can't do that because the FDA has said that we, you know, can't manipulate these tissues. So really what we'll do is you know, they'll do the liposuction. They'll basically just kind of screen out all the other cells and take the fat and then inject that back into the knee or wherever it is that the area of concern is. So does adipose tissue work for arthritis? There's really no current literature to suggest that it works because, number one, it's a newer treatment option. Number two, there just hasn't been enough studies that suggest that it works. But I would say that at least from anecdotally, I don't use it myself, but I know other surgeons across the country that do, and they say that it works well. There are numerous ongoing studies. And so, you know, the answer is in the works. And again, we go back to this strong anti-inflammatory effect, but it is quite expensive. The most recent webinar that I watched with the Biologic Association, I think the average was around $5,000 for an adipose treatment. And again, it's invasive. So, you know, some people might look at it as a 2-for-1 because you get a little liposuction on your abdomen and you get a little treatment for your arthritis. So, you know, it is an option, but again, it's invasive and it is expensive. And so I think probably what most people want to know on here is, am I a candidate? And I go back to Really, that is an individual discussion. And I would tell you that I would counsel you that if you've been to one of these quote unquote stem cell clinics and you're hearing from a nurse or a chiropractor or a non-physician, that you know, take all those things that they say with a grain of salt now that you've sort of heard what literature and evidence is actually available to you, and that you counsel with your orthopedist about, you know, what options there are and what they actually would tell you may potentially work. So, you know, if you look at this x-ray here, if this person came into me and they've got bone on bone arthritis, and their knee is, you know, is all degenerative, I would tell this person, yes, you are a candidate, but it is very unlikely that any of these biologic treatments are going to provide you any long lasting pain relief. And so, you know, yes, you're a candidate, but probably not going to work all that well. And so most of the studies have shown that there's the most improvement is seen with patients who have mild to moderate arthritis and less improvement with severe arthritis. And so, again, we're not going to take this person's knee and suddenly, you know, give them a couple of injections and then suddenly 3 months later they've got cartilage regenerating in there. And so, you know, that to me is completely false advertisement. There's no evidence that that can happen. And so, you know, just keep that in the back of your mind when you're getting these treatments. So in summary, there's a lot of confusion out there, mostly because it's unregulated. And so, you know, some of the nomenclature about stem cells is really confusing. The majority of the quote unquote stem cell clinics are not using true stem cells. And I would tell you most of them are probably injecting amniotic fluid, which again does not contain any viable cells, many of them being done by non-physicians, charging thousands, you know, of dollars, and they're not covered by any insurance companies. So, you know, before you sort of take that leap of faith, I would consult with an orthopedist to see, you know, if they feel it's an option and what evidence says or suggests would help them, and give them some more realistic goals and options about their treatment. So PRP, BMAC, amniotic fluid, adipose, I'm sure in the next probably 5 to 10 years, we'll see even more things available. Most contain little, excuse me, little to no true stem cells. They work mostly due to the growth factors that decrease pain through that anti-inflammatory effect that we talked about, and none of them have any evidence for cartilage regeneration. Thank you very much. So I will open the Q&A portion. If anybody has any questions, happy to stay on here and answer anything. If you want to, you should be able to open the Q&A portion of the call there and type them in. Somebody emailed a question in. Is it easy to get in to see me? I'm in the office every Monday, Wednesday, and most Fridays. And generally I don't have a long wait to get in. So yeah, it's fairly easy. Is insurance coverage for PRP likely in the near future? Is the FDA regulation on not manipulating body tissue an ethical or a safety issue? So number one, is insurance coverage for PRP likely in the near future? Most orthopedists and people who use PRP and are familiar with FDA regulations would tell you that it likely will never be FDA approved. And that just is because in this country, we have so many regulations and it's so difficult to get something approved by the FDA. And in PRP's situation, it just is going to be so cumbersome and difficult that it likely will never happen. And so unfortunately not going to be covered by insurance companies. Probably most people are on here are wondering how much it costs, and it's all over the board. I've seen anywhere from a couple $100 up to a couple of $1,000 for one injection. I can tell you that our practice and me personally, I charge $650 per injection, which I think is pretty reasonable. And then, is the FDA regulation on not manipulating body tissue an ethical or a safety issue? I think it's both. It's probably more of a safety issue, but there's certainly some ethical considerations to think about, and that's, again, why if you go to Europe, you can have a lot of these treatments done, no questions asked, because they don't have the oversight boards that we do. And in Europe, they've been doing PRP for 30 plus years, whereas it really has only taken off in this country probably in the last 15. Another question, could this be a one-time kind of injection to help with pain before I have to get a total joint done? I think that's certainly a reasonable consideration. If you ultimately know that you're going to have a knee replacement, but you're going to try to put it off. Let's say right now, I have many patients right now who don't want to have surgery because of the current COVID pandemic. I have given numerous people different types of injections in the last couple of months, whether it's cortisone, whether it's PRP, whether it's, the hyaluronic acid. Certainly, I think a PRP one-time injection is something that you can try. It's not going to burn any bridges as far as having any future surgery or any future replacements. Well, if there's any other questions, go ahead and type them in. Let's see here. What type of activity can I do after having? If you have PRP, I tell people to, just like with any knee injection, take it easy for a couple of days, but then you can sort of gradually get back to normal activities. And, it's just a blood draw, so there's no concerns regarding that, but just normal daily activities is fine for the first 2 days. It'll be a little sore. You can't take anti-inflammatories, so we recommend just Tylenol and ice for the first 2 weeks. But then, after a few days, you should gradually be able to get back to normal. Obviously, if you have something more invasive like the bone marrow aspirate, that's probably the more painful portion of the procedure. And so that would probably limit you some for the first week or two. Another question, has PRP been shown to work in the neck and spine? I don't know that answer specifically because I'm not a spine surgeon, and so I don't keep up with that literature. I'll tell you that there certainly are clinics, and I hear of patients who are getting PRP in their neck, back, spine. So there must be some evidence to support its use. And again, it's a strong anti-inflammatory, so it makes sense to me, but I would definitely recommend consulting with a neck or spine physician before you have that done. Another question, does bone on bone eventually lead to surgery? It can, but doesn't necessarily mean that it has to be done. Any joint replacement we still consider to be an elective procedure. So I have, you know, probably hundreds of patients who have bone on bone, shoulders, knees, hips that are just living with it. And will it eventually lead to surgery? For some, it most likely will, but for others, they choose to just live with it like it is, and it's never gonna, you know, that's not gonna be the reason that the patient ultimately passes away. You know, it's more of a pain thing, and so if you can put up with it, then people can live with bone on bone indefinitely. And I would encourage, you know, any of you that if you have specific questions or you want to be evaluated, then you can, you know, leave us your contact information, and Lisa, one of our um, girls that's helping out with the webinar here that works in our office, is on with me here, so she can take your information and reach out to any of our doctors or me specifically as far as an appointment goes. You know, and you can, if you're currently a patient, you can go onto the portal and request an appointment. There's multiple different ways that you can do it, or obviously the old-fashioned way of just give us a call. Another one, what is the price range of PRP? So like I had said before, maybe you didn't catch that. I currently charge $650 for one injection. I think that's pretty standard across our practice. But again, that's, I've heard anywhere from a couple of $100 all the way up through a couple of $1,000 per injection. I think I saw recently the average is somewhere around $1,200 per injection. And again, unfortunately not covered by any commercial insurances or Medicare. All right, any other questions? Yeah, Lisa's giving me I think we're all done there. So I appreciate you guys coming on. If there's any other questions, certainly you can feel free to reach out to us, and appreciate you being on here. Have a good night.